We're going to be hearing from Chris Napolitan, who's the Vice President of Prime Education, who's going to speak a little bit about some webinars that the ALD Alliance was able to help participate in this year. So welcome, Chris.
Thank you very much. I'm going to attempt to share my screen now. Just bear with me, guys. Okay. I want to make sure the audio is enabled. Share computer sound. Okay. Can everybody see my screen? Okay. So thank you so much. I'm thrilled to be here and to talk to you about Prime's patient-centric approach to advance evidence-based care in ALD. Before I start, I just want to thank Elisa Seeger and Miranda for inviting me to present. The ALD Alliance does some amazing work in bringing awareness and supporting families across the country in dealing with this devastating condition. So just some more background about Prime before I get into the ALD project. So Prime's a leading research and medical education company. We've been in business for about 27 years. We produce accredited medical education programs that help providers maintain their licensure and stay up to date in the latest evidence. And we cover a wide range of therapeutic areas, including rare disease, and a multitude of formats for our programs. I think one thing that kind of makes us a little bit unique in our approach is that we're very research driven. So we want to make sure we clearly understand the gaps responsible for variations in care. And so we do work with health systems to pull chart data. We have a scientific affairs team that stays up to date on the latest evidence, and we build relationships with key opinion leaders. And it's this research-driven approach that has led to numerous publications that we've had over the years that really outline the impact that our programs have in improving health outcomes. Another key element is that you'll see with our education and in our work with ALD is that we're not just focused on providers. We want to focus on addressing gaps across the interprofessional team. And by understanding what's happening with each healthcare stakeholders between providers, patients, payers, and systems, that really allows us to develop customized interventions that can lead to sustainable improvement. So when we began our work in ALD, we first want to take a close look at the gaps that were occurring in the cascade of care. So this is just a summary of some of the key themes that we focused on. So there's obviously clear barriers to early diagnosis as a result of the limited number of states with screening programs. And then obviously, even when a patient gets identified, there's challenges in care because there's not centers that specialize in ALD, as we can see from the quote from Elisa at the bottom. And then since ALD is such a rare condition, providers need to improve their disease awareness, have a better understanding of the impact of the condition. And I was just really touched by, Amanda's story, and we tried to pull that through in our program. So, and I'll show you examples of how. And then also too, while there are promising trials, the only available treatment option right now is stem cell transplantation, which studies have shown to have benefits, but also significant risks. And this program did also include a focus on cerebral ALD phenotype, for which early detection and close monitoring is really important. And then finally, to appropriately manage ALD, patients have to interact with numerous members of the interprofessional team. I think that's something that will come through in the examples that I show you. So this slide just goes a little bit deeper to kind of outline the objectives of our program. So we're focused on helping to providers apply guideline recommendations for evidence-based newborn screening. We realize that it's different state to state, but we really want to make sure that providers understand the right approach for this and raise awareness of this according to the guidelines. And then integrating guideline recommendations for disease monitoring is key. Evaluating current evidence on the safety and efficacy of current emerging treatment options, and then strategies to identify and optimize communication with the multidisciplinary team and between providers and patients and caregivers is really key. In terms of a format for the programs, we did 2 30-minute webinars in which participants can tune in for like a live virtual session, just like we're having now. And that format is really key because we see it actually has the greatest impact because the participants are engaged with the speakers, they can ask questions, etc. So that's why we went with that format, and we actually repeated each of the sessions. So if a provider couldn't attend one, they had the ability to attend the next one. To scale up the impact of the program, we recorded the sessions and made them available online afterwards. Another thing I just kind of want to highlight, the agenda aligns very much with the learning objectives, but the part I want to call out is that our programs really detailed real-world impact that ALD has on caregivers, and we did this by sharing experiences and their journeys with their children. And this is why we called the program The Faces of ALD. These stories, like Amanda's, are so powerful to helping providers become more aware of rare conditions like ALD and the impact that it has on patient caregivers' lives. So I'll share some examples that came from our work with the ALD Alliance. And then we're also really fortunate to have been able to work with an all-star group of faculty on this project, including Dr. Eichler, Dr. Malik, Dr. Waldman, Dr. Van Haren, and of course, Elisa. And then to expand our reach, the program was really focused on reaching pediatricians, pediatric neurologists in the clinical teams, as well as genetic counselors. So we partnered with the National Society of Genetic Counselors and MedPage Today, which is our sister company that has a large opted-in database of US physicians. So this slide just summarizes the learner engagement that we saw from the program. So we were fortunate to have over 1,700 registered learners, of which 800 completed the full program. 36% of the participants with physicians, with the majority being pediatricians or pediatric neurologists. 24% were genetic counselors, and the remaining members were members of the care team. And as you can see from the map here, we had strong representation across the US. We asked the learners' self-reported caseload for ALD patients, and that exceeded 4,800. So I'd now like to build on the point I made earlier about the unique elements of the program by sharing some real-world perspectives that we included. So I have some video clips to share, but before I do, I just kind of want to set the stage by calling out the examples that we used. And I think like what's really eye-opening is how different each of these caregivers' experiences were. So for Miranda, for example, was fortunate. Her son Jack was diagnosed 12 days after being born through newborn screening and is currently asymptomatic as a result. Jillian had a much different experience and was told by 4 providers her son was fine, but as you will hear from her story, that if she didn't advocate for him as strongly as she did, her son Grady would be in a much different situation. Elisa's son Aiden was a late diagnosis and devastatingly lost his life less than a year later. And Liliana has 2 sons, Brandon and Brian, both who have ALD or diagnosed with ALD. Brandon was a late stage diagnosis, and Brian was able to get tested as a result. So the outlook is more optimistic for him. So I'm going to play the parts of our program, and just let me know if you can hear it. Let's see here.
Receive a call from his first grade teacher. She was asking if everything was okay at home. She said that she noticed Brandon was very distracted and losing focus in class. And it wasn't like him. We took him to the pediatrician, and she's noticed that his gait was a little off. So she said, let's take him to let's try taking him to a neurologist. By the time we went to the neurologist, she noticed that his left side was weak. She asked him to put his hands straight like he would be holding a pizza, and he was off. So she recommended we do an EEG and an MRI. There were 4 doctors. They said that they needed to speak with us. So my husband and I went to a room, and they brought a nurse to watch Brandon. And they brought some pictures to explain what adrenoleukodystrophy was and how the myelin was damaging. And we didn't know why they were telling us this. And they said that that's what Brandon had. And we said, that's not possible. He's healthy. He never hurt his head or anything. And they said it's a genetic, and we never were concerned about genes or anything like that. I mean, they explained how the diagnosis was serious and how there was no cure. So we were devastated.
Son Grady was 7 at the time. We started noticing some very minor changes with him. About a span of 2 weeks, we noticed it seemed more like confusion. I would repeatedly ask him to get his shoes or put his shoes on, and I would have to say it 3 or 4 times, and then he would say, "There's no cow in the house," or something absurd in response. So we brought in the pediatrician, asked her if it could be anything neurological, and she didn't think so. She said we'd follow up with ENT down the road, and we went home. She called me about an hour later and said, "You're not an alarmist. Let's see ENT today." Something just, she knew I felt off. And they had neuro come and consult him. They said, "Your son's fine," but they would ask him 3 times 4. He would say football. They said, "Could you put your arms out like this?" And he jumped off the stretcher and started doing push-ups. It was just really weird responses, but they felt he was fine. They said, "We'll follow up with another consult down the road." And I asked if they would scan him. And they said, "No, he's fine." But I brought him back first thing in the morning, and I just refused to leave the ER until they would scan him. And a few hours later, they agreed to scan him, and unfortunately led us to ALD. Had I just gone home and sat it out, there wouldn't have been treatment in 3 more months or so. Grady might not even be here today, most likely, or would be a lot worse off than he is right now.
So on Jack's 12th day of life, we got a phone call from the pediatrician's office. And it wasn't a pediatrician, it was someone who worked in the office. And she said Jack was picked up on his newborn screening for adrenoleukodystrophy. And then they automatically referred us to the metabolic center that the diagnosis came through to. So we were given the name of the institution, and we were given a phone number, and they said call right away. So the phone call from the pediatrician's office was very brief. You know, we got that news, and then we automatically called the metabolic center, and we were connected with a nurse practitioner in the genetics department. And she spent a lot of time with us on the phone. You know, she told us what the diagnosis was. So we got the phone call on day 12, and on day 13, we were already in her clinic, you know, going over everything in person. And then, of course, repeating that test to make sure the results were accurate. And I think that's part of the reason why our story is kind of more of a success story, because we were seen very quickly after getting that diagnosis. I think what was nice too is that genetics is kind of like this neutral zone with this disease. You know, it's multidisciplinary. You find out, you know, you have to see a neurologist, an endocrinologist, you might want to see someone in nutrition. But of course, first and foremost, you want to repeat the test, and then there might be other family members, especially if there's an older sibling that needs to get looked at. So I kind of liked that our journey started in the genetics department.
I have one more clip.
That started us on the Diagnostic Odyssey. We went from, you know, ophthalmologist to pediatric ophthalmologist to a retina specialist, finally back to the pediatrician who recommended a neurologist. And on the neurologist visit, he even thought nothing was wrong, but he said, let's get an MRI to make sure. And that's when we got the diagnosis of ALD.
So we thought something was wrong with his eyesight. We took him to a ophthalmologist, pediatric, and she looked at his eyesight. She said that he had a perfect eyesight. It was 20/20, and she was able to look at the nerves in the back, and she said they all look healthy. So, if there is a possibility of a tumor, it couldn't, because his eyesight is great. By the time we went to the neurologist, she noticed that his left side was weak. She asked him to put his hands straight, like he would be holding a pizza, and he was off. So she recommended we do an EEG and an MRI. So we also saw an endocrinologist. She was looking for the HTC level. And also found that Brandon needed hydrocortisone. So we take care of Brandon. We put all our hearts and all our time to him, and try to break it with my little one too, who also was confirmed that also had the bad gene, Brian. He was 3 years old. And we were double devastated, because we only have 2 children. But then there was hope for him, because it was early.
So as you guys can see, these are very powerful stories, and really such an important piece to provider education. We heard so many different things in these videos with regards to symptoms, with regards to testing, the Diagnostic Odyssey, the referral process, patient-provider communication, but most importantly, just the impact that the disease has on patient caregivers' lives. And so what we look to do is really build off these points to highlight the importance of following guidelines, following recommendations for screening, optimal communication strategies, as well as covering the different approved and emerging treatment options. So to measure the impact of our program, what we do is we look back at the learning objectives, and we ask, develop and ask survey questions before and after the educational activities to really assess the impact that the programs have, and improving knowledge, improving confidence, and self-reported performance in alignment with the objectives. We also want to look at perceived barriers in applying the applications of the latest evidence presented during the program. This is an active program now, but we're also are going to conduct sub-analysis on the data, so we can look at the outcomes by profession, by specialty, by location, practice setting of the providers, because that will provide some great insight. So this slide just aims to kind of highlight the educational impact that we've seen thus far. So on the left here, we tested participants' knowledge with regards to being able to correctly identify data from a recent trial on gene therapy. So we saw a nice increase, only 30% before the program answered the question correctly. After the program, 56% did, so a nice increase there. We also tested the learner's ability to correctly identify the cerebral ALD phenotype. So we saw a nice increase from 61% to 77% after the program. And then finally, this last question was more case-based with regards to testing. So we presented a case with a seven-year-old boy who was hyperactive, had vision problems, and the MRI did not reveal abnormalities. So the question is, was the right test to perform? And so we saw a nice increase from 30 to 56%, with the correct answer being blood test assessing long-chain fatty acids. And in terms of just challenges that we're able to see, the top challenge to treating patients with ALD that the provider learner participants reported was just being able to identify and diagnose the condition. After the program, we asked the participants what are the key action plans that they want to implement. And it was really encouraging to see some of the top results, which were to educate team members about some of the identifying features of ALD and to be able to really communicate the need for newborn screening for ALD with team members. And then finally, just to improve the referral processes around screening and monitoring. So this kind of builds on the challenges, goes into a little bit more detail. So as I mentioned, identifying and diagnosing was the top one, but there's, I think, a few other ones worth calling out. Lack of clear treatment guidelines, confusion around the treatment guidelines, lack of care coordination across practices and specialties, and disease monitoring were also challenges that were brought forth. So we also look to measure the participants' confidence in the follow-up procedures regarding recently diagnosed patients with cerebral ALD. So we asked what's the proper follow-up procedure for a 7-year-old who was just diagnosed. And the correct answer was to recommend stem cell transplant with MRI 3 months following to assess the disease progression. And so, the green bar represents the pre-program results, and the blue is the post-program. So we saw a nice increase there. And this goes into a little bit more detail around the action plans that the providers wanted to implement following the program. So educating team members on identifying features of ALD, the communicating the needs for newborn screening, and then just really being able to improve the care coordination and referral processes. We also importantly give our participants the ability to submit questions before and during the program. So the questions really focus, I'd say, in 3 main categories. And it's really around the purpose and execution, accuracy of testing, some questions around different phenotypes, and then really with regards to treatment, treatment for specific cases, the efficacy of the different options. So by giving the participants the ability to ask questions, before and during the program, we can address them, with leading experts. So that's all I have for you, but I really appreciate the opportunity to present.
Thank you so much, Chris. So at this time, I'd like to open it up if there's any questions, whether you'd like to raise your hand or use the chat feature. We can keep an eye on that. Just for any of the families that might be on, I would say no medical questions, obviously, if there's just any questions about the actual webinars themselves, please feel free to go ahead and ask now.